My name is Maureen Corcoran. I'm the director of the Ohio Department of Medicaid. When the governor asked us in 2019 to transform the Medicaid program, our North Star became very clearly putting the individual first rather than the business of managed care. And that became the organizing principle for all of our design work. Change in healthcare takes a long time and it's very steady. We wanted to really make a dramatic step up, a next generation, really leapfrog based on the experience and learnings of our team and other states across the country. And so it was first a process of listening. It was a process of intensive design, looking at all of the components, and in particular, our OMES and our infrastructure that I view as the scaffolding for everything that we did, our implementation of a single PBM, the implementation of a specialty managed care plan for multi-system youth with very complex behavioral health needs. And this was a dramatic culture change, a dramatic policy change to say we're going to look at every policy with the individual at the center of our thinking. Another example, we heard so clearly from families across the state who have children with multi-system needs, young people who are served by several different systems but have significant behavioral health problems, that they really felt like there needed to be a specialty emphasis, a dedicated emphasis that looks uniquely at their intensity and complexity of needs. That gave birth to Ohio Rise and all of the things that we've mentioned and we're all dealing with across Medicaid programs about the need for better data to support decision making, to improve transparency. So a hallmark of our work was to improve the transparency of our program and to make more data publicly available. PBM gave us an opportunity to be completely open and transparent about the cost of acquisition of drugs in Ohio and using that as a basis for our reimbursement. A survey done, required by all pharmacies who participate, that serves as the basis for our dispensing fee. All of that is publicly available. Ohio Rise is a specialty managed care plan that is responsible for coordinating and paying for all of the behavioral health services for children and youth across all the various systems where kids receive services, and doing that in a managed care framework, utilizing the system of care principles and model that was developed by SAMHSA and has been researched and presented to Congress, evaluation presented to Congress on numerous occasions. That's Ohio Rise. One of the unique characteristics of Ohio Rise is that we utilize the Child and Adolescent Needs and Strengths Assessment tool developed by the Craig Foundation, and we use it across all of those child-serving systems. That has enabled us to see not only the diagnostic and clinical kinds of considerations that these youth have, but to look across all of the systems to see what the kinds of needs are, where additional specialty services are needed, to be able to look again from a planning point of view across all of the youth that we serve. In the interaction that I have had and that our staff have had with individuals and with family members is truly filling our souls with the purpose and the knowledge of why we're doing this job and why it is so important.